vaccine. So we're proud to share that really great news. Starting on May the 27th, the community vaccination clinic site will be switching to the single-dose Janssen vaccine. I want to remind people that that site is open from 7 a.m. to 7 p.m. 7 days a week. No appointment is necessary, no identification is required, no insurance is required. Individuals can walk right up or drive up, and in a matter of minutes, you can receive your shot. We think we may begin to see even more people visiting that community vaccination clinic site to get their shots once the one-dose Janssen vaccine, and that's also referred to as the Johnson & Johnson vaccine, will become available there beginning on May the 27th. In addition, we've heard many concerns from religious organizations and other entities about the return to normal gatherings. And so we want to make this very clear that it is the unvaccinated people in any setting who are at highest risk for contracting the infection from the virus that causes COVID-19. So not having a vaccination usurps racial, ethnic background, gender, or any other demographic when it comes to the risk of getting the disease. We're glad that we're continuing to see progress, but it's more important than ever to get a higher proportion of our population vaccinated as community activities are opening up. Those who are unvaccinated and unprotected are still recommended to use social distancing, hand washing, and to be cautious in gatherings with large crowds, such as concerts or religious events or anything of the kind. We want people to remember that this pandemic is really far from over, despite our encouraging trends. And so we really need everyone to get on board so that we can keep ourselves and our loved ones safe. And that concludes the briefings. I want to thank everyone, and I'm happy to entertain questions now. Thank you.
Thank you, Dr. Bell, for that update. And at this time, I'm going to ask you the questions that we received earlier today. Starting with the first, since last week, how many 12 to 15-year-olds in South Carolina have gotten their first dose of COVID-19 vaccine, and has the number been higher or lower than expected?
Thank you, Christy. We have documented that a total of 9,226 doses of the Pfizer vaccine have been distributed to those 12 and 15 in the state so far, with 8,949 of those have been administered to South Carolina residents in the 12 to 15-year-old age group. And so we're very encouraged by this early turnout, but of course, we're continuing to ask everyone in that age group and above to get their shot as soon as possible. It's hard to say what we would have predicted, but what we want to see is a continued and stronger turnout for vaccination in that age group, because we don't want anyone to forget that getting the vaccine is really the only way to protect yourself reliably and for a longer period of time from those around you who could be spreading the virus. And so it is by vaccinating everyone in our population who's eligible that we can get an end to this pandemic and the beginning to returning to our normal lives.
What resources are currently available to vaccinate homebound or bedbound South Carolinians in the Midlands, and how can they access them?
Okay, thank you, Christy. At the end of February, DHEC worked with Agape Care to pilot a homebound vaccination program, and that was done in 2 counties in Jasper and Hampton. And to expand this effort statewide, DHEC has issued a solicitation for providers to help support this effort to reach those who are homebound. That solicitation period just ended this past week, and so we have awarded the contract to 2 groups, and we want to make notice that Welcome Pharmacy and H&M Labs were awarded the contract. These 2 groups will be working with DHEC to help us expand our homebound vaccination program across the state. And we've learned through the pilot program in the Jasper and Hampton counties that many homebound individuals had already successfully received their vaccinations through the assistance of family and friends. And so we've also learned that using the Janssen vaccine is really an ideal product for this plan, since it only requires that single shot and no follow-up visits.
Dr. Bell, counties in the Grand Strand are nearing herd immunity numbers. For example, Horry at 66% and Georgetown at 69%, per some MUSC reports. However, both numbers include natural immunity to the virus. So will these numbers decrease in upcoming months as natural immunity lasts up to 3 months after contracting the virus? So will those numbers decrease?
Yes, we do need to be cautious about including people among herd immunity who have their immunity from natural infection. Because although the duration of immunity from natural infection can vary from one individual to the next, it could be 3 months or shorter, or it could be longer. But what we know is that immunity from the vaccine lasts much longer. So when we're thinking of a goal to reach for herd immunity, again, we have to be cautious about including those who have natural infection, because that does tend to overestimate the proportion of the population who have achieved and will retain immunity to help us with reaching our goal of overall herd immunity.
Since vaccinations have been available, have most residents received them, and have most cases and deaths among these residents decreased?
Well, you can visit our online vaccination dashboard to see the number of residents who've received their shots, and that's all actually broken down by county. You can look at coverage rates by county. As of today, 42.7% of eligible South Carolinians have received at least a single dose of the vaccine, and 34.9% of eligible South Carolinians are considered to be fully vaccinated. And yes, our state has seen a decline in cases and deaths, and we attribute that to the success of the vaccine. And also, when we look at highly vaccinated populations, the best example I can think of is in nursing home residents, where we have seen the most dramatic decline in cases and deaths because we achieved such high coverage among those vulnerable individuals.
And Dr. Bell, where does South Carolina stand with COVID-19 variants right now, as hospital studies show variants such as the South African and UK variant has increased with 50% transmission rates? Is there a chance these numbers, and is there a chance these numbers increase as CDC lifts mask mandates to those who are vaccinated?
Well, two questions there, and I'll actually take the second part of that question first. It is not only that cases due to variants would increase or may increase if we're those who are unvaccinated are not following the CDC guidance, but an important point to make is that case rates due to the predominant strain as well as variants will increase. So we don't pay as much attention to the risk from the variants per se. But when we look at where we stand in South Carolina with the South African, with the UK variant and the other variants that are being reported, it's important to understand that the CDC is asking states to report the proportion of the isolates that are studied through genetic analysis that are found to be various variants. You can actually go to the CDC website and look at what CDC has defined as variants of concern and variants of interest. And there's an excellent description there that explains why we're interested in how these variants are circulating in the population as a whole, and most importantly, the proportion of all that are studied that are made up of variants. And the other important point to make is that we know that there are variants circulating that are undetected because all isolates do not get that to genetic analysis. So from a population perspective, it's important to understand the implications of these variants, because we understand that they can be spread from person to person more readily. Although of yet, we don't believe that the most predominant circulating variants cause more severe disease or result in a higher risk of hospitalization. They can result in more cases because they're more easily spread. And this is another reason why we need to get our vaccination proportion rates up more quickly.
So according to the CDC, the vaccination rate in rural counties lags behind cities and could hinder the end of the pandemic. What is DHEC seeing in South Carolina when it comes to vaccination rate in rural areas, and could these areas cause a delay in ending the pandemic?
Thank you, Christy. And again, our online vaccination dashboard is updated every day, and it provides a detailed list of who's getting vaccinated anywhere in South Carolina. And so for our state, small towns and what we call micro populations are really ahead of the metro populations. But the rural areas in some aspects are lower. We do actually have some rural counties in our PD area that have higher than the average in the state. So we're continuing to hold more and more vaccine clinics to address access issues in our rural areas, because we do want to get those vaccination rates up in rural areas. It is a significant issue. And we want to make sure that we remove every barrier that may be getting in the way to help those in our rural communities have access to the vaccines. We actually finalized today a vaccine postcard that will be direct mailed to every household in the state, ensuring that those in our most rural and sort of disconnected areas are receiving directly to their mailboxes information about why the vaccine is so crucial and how they can get a shot from a provider that is conveniently located to them.
And have any cases of the B.1.617 variant been identified in South Carolina? And if so, in what public health regions?
So that B.1.617 variant, also known as the Indian variant, has been identified in South Carolina. And 2 of those cases were identified in the Midlands region, and 2 were identified in the PD region. Again, it's important to understand what those individual case reports mean, because the CDC has asked states to discontinue that case level reporting of variants and to really focus on the proportion of the total variants or the total isolates that are genetically analyzed, so that we can understand the proportion that's circulating in our population that makes it more meaningful about the impact on the population. So it's important to note that the effectiveness of our existing vaccines, what they have on that Indian variant, is really unknown at this time. We do believe that the currently available vaccines are effective against the known variants of concern and the variants of interest. Our current public health recommendations on the individual level, though, that they do not change with respect to the proportion of variants in our population, because the measures that individuals need to take are the same. And it's that everyone needs to protect themselves from being potentially exposed to the originally identified variant, to the predominant circulating strain, or any other variants. The prevention measures are all the same with vaccination, and for those who are unvaccinated, to continue to wear their masks and practice the physical distancing.
And so, Dr. Bell, I know we had a previous question a little bit similar to this, but for homebound or bedbound patients, how do those care providers get someone to come to those patients to administer the vaccine?
Well, yes, as mentioned earlier, we did start the pilot programs for bringing the vaccine to homebound individuals in the 2 counties that I mentioned. And now that we're working with Wellcome Pharmacy and H&M Labs to expand those services, we will be providing additional information and details to our residents as those efforts expand as to how they can access those homebound services.
And Dr. Bell, what's your outlook on the state's coronavirus outbreak, and what level of disease spread do you expect in, say, early July?
Yes, I certainly appreciate that question and would love to be able to make predictions. And I can actually see our outlook going in 2 directions. My hope is that this continued positive trend with the decline in disease rates will continue. I hope that we will have a more swift uptick in our vaccination acceptance, which will help push those disease rates down. But as public gatherings and things like that begin to reopen, if individuals who are unvaccinated do not continue to practice the prevention measures, then we run the risk of our disease rates going in the other direction. We run the risk of seeing surges. This has occurred in other communities and in other countries. So I would like to be cautiously optimistic that people will take to heart the benefit of the vaccines and will take advantage of those protective measures that will continue to drive our disease rates down. And so beyond that, I really can't say what we expect to see in July. I want to encourage individuals about the amount of control that they have and the power they have to help us be in the most positive position as possible when we reach July by getting vaccinated as soon as possible.
And Dr. Bell, you mentioned the word surge a moment ago. And so this question kind of speaks to that. So is a post-Memorial Day COVID-19 surge possible this year, or is that not a concern?
I would say that it is a concern for several reasons. COVID is of course still circulating in our communities. Currently, the CDC actually categorizes South Carolina as a state that has a moderate ongoing disease transmission. So we don't know what the post-Memorial Day events might bring. There have been these questions about the variants. We don't fully expect this, but we also have to anticipate the possibility of the emergence of viral variants that could escape protection from the vaccine. And so if we can continue to drive our disease rates down before that theoretical possibility happens, that will put us in a much better position. In the past, we have seen cases increase after holidays when gatherings have increased. But now with the availability of highly effective COVID vaccines, we hope that people will avail themselves of the vaccination to decrease the risk of possibly transmitting COVID to others. We don't know that those who are not vaccinated are currently, well, actually, we know that those who are currently not vaccinated are the most susceptible. So those are the individuals that could really drive that disease curve in the wrong direction. And for that reason, our public health message remains focused on ensuring that people take appropriate precautions with regards to protecting themselves if they're unvaccinated.
So how does the vaccine factor into keeping immunity rates up, and what does DHEC recommend for communities to consider with natural immunity being short term?
Well, the way the vaccine factors into immunity rates is that it gives us the longest protection of immunity. We know that it is several months longer than what we get with natural immunity. We hope that it is at least a year, possibly more. But when we consider the natural immunity, and the question was asked earlier about these estimates of herd immunity, we know that that wanes. We see this with reinfections among people who have previously had COVID and are getting it again. So when we consider that natural immunity, we really can't rely on that. Our best bet is to get as many people vaccinated as quickly as possible so that we can have sustained duration of immunity in the highest proportion of the population as possible.
And so can you please give an update on our state's current guidance for nursing homes? Since the CDC released their new recommendations for those fully vaccinated, have there been any changes?
Well, DHEC continues to direct nursing homes to the latest CDC and CMS guidance. DHEC's long-term care facility visitation guidelines, which are also available online, are consistent with the current CDC and CMS guidance. Masks are still required to be worn in these types of facilities by staff and residents, as they are in all congregate settings, to best protect those individuals who are at highest risk because of being in a congregate setting. And also, DHEC continues to monitor both the CDC and CMS guidance to ensure that our guidance mirrors the federal guidance that is available.
Studies show a spike of transmission increasing dramatically in April and May. Is that a concern going into the summer?
Yes, as I said earlier, that is a concern as we're seeing more community gatherings opening up. It remains a concern until we get the highest proportion of our population covered with protection with the vaccine as possible. We still have, we have these encouraging trends. Almost 40% of our population is considered to be fully vaccinated, but that still means that approximately 60% of individuals, including those under the age of 12 who cannot yet be vaccinated, are still at risk. And so those surges in the summertime are possible as community gatherings open up.
And Dr. Bell, how many 12 to 15-year-olds does DHEC anticipate getting the vaccine?
Well, as I said earlier, that's hard to anticipate people's behaviors, but we're certainly encouraged by the pretty quick uptake of nearly those 9,000 doses given in that age group since it was made available in the 12 to 15-year-olds. So we hope that this continues, and what we want is to encourage parents to talk with their healthcare providers or their pharmacist about getting their children vaccinated. We encourage parents to visit the CDC website that has excellent information for them to consider when they're preparing their child for vaccination before, during, and after. And I'm also really encouraged by the number of young people who have reached out and are posting things on social media and things like that they got their vaccines. And I hope we can look to that demographic to encourage their friends to also be vaccinated.
That's a great lead into this next question, Dr. Bell. So is DHEC aware of any vaccination clinics in the works just for teens in South Carolina?
Well, we're working with the Department of Education, and we've received notification that several school districts that have planned vaccination clinics for those 12 to 15 years of age, as well as their family members. And so those will be excellent opportunities for access. And we're also coordinating with the Department of Education on teen outreach for several partners who've been proactive in reaching out to schools and their communities to begin offering or planning for school-based clinics because that's so convenient for families. And as plans for these school clinics are finalized with the schools and with providers, they'll be promoted. So in those local communities, we will let folks know what's available to them in school settings. We're not sure right now how many will take advantage of this or will lay those plans out, but we will continue to encourage all locations that are convenient for families and adolescents so that access is never a barrier.
Thank you for that, Dr. Bell. At this time, we do have one more previously submitted question. I do like to give the reporters sort of a heads up that we've just got one more question so they can start throwing their virtual hands up to ask you live questions here in a few moments so that we don't have a lull and that we're making good use of our time together, Dr. Bell. So this last question, with the new masking guidelines, some people argue when an unvaccinated person decides to go maskless now, it's only a risk to themselves since others around them would be protected by the vaccine. Are there any pitfalls to that logic?
Yes, there are some flaws in that logic. We are, of course, concerned about the individuals, and we want to prevent individual cases, hospitalizations, and individual deaths. But this is a respiratory disease that is spread from person to person. So when individuals are at risk, we're all members of the same community. And so when there are more individuals who make that choice not to get protected when they get sick, they do spread it to the rest of us. So the flaw in that logic is that when members of the population, especially large numbers of the population, are not well protected, that continues to put us all at risk. It continues to lead to potential surges that we've discussed, and it puts us all at risk for ongoing transmission that could be interrupted if we have a higher proportion of people who are vaccinated. It just makes it much more difficult for the virus to find susceptible people in the population when we have more people who are protected. So it's an important point to make that they're not just making these choices for themselves as individuals. It can affect them, but it can also affect the other members of their household, their loved ones, their friends. So it really is not just an individual choice, and it is really not just an individual threat. And we ask people to really take that into consideration, that they're potentially not just harming themselves, they're harming their family members and their community.
Thank you, Dr. Bell. At this time, I am going to open it up for live questions. So reporters, I will call on you by name. If you will unmute and ask one question of Dr. Bell. If there is time left, it looks like we've got about 15 minutes today. So if there's any time left and you have a second question, just shoot your hand back up, because after you ask it, I will be lowering your hand. MK Wildman, you've got a question for Dr. Bell?
Hi, Dr. Bell. My question is, given we're kind of in this masking gray area, I guess, what would you say to a business owner who's considering taking down the, masks required sign, or kind of considering changing the recommendations around that? And as a quick follow on, is DHEC working to provide any further recommendations for businesses specifically?
Well, I would ask business owners to be aware of the risk to their workers and their clients, because especially for individuals who work in a setting where it's not easy for them to protect themselves from exposure to others. So when you relax mask requirements indoors in particular, you're continuing to put individuals at risk who may not be protected. Individuals who may be susceptible because they have immunocompromising conditions, even if they're vaccinated. Also children who cannot yet be vaccinated. So I hope that business owners will take all of those things into consideration, that they can still be very helpful and very effective in our communities in protecting their workers and protecting their clients who are not vaccinated.
Kaylin, you've got a question?
Yes, Dr. Bell, can you please tell us what the timeline is for the services for homebound individuals to be available and how they can check back for more information?
Yeah, I might have to, we might provide that information for you at a later time, because we have just secured the contracts from those two providers. And to my knowledge, we do not yet have the plans fully laid out for a timeline for those services to be available, but we will be promoting those services, and we will make individuals aware when they're available, how they can access them.
Mike, you've got a question?
Yes, thank you. The mask policy was relaxed substantially last week. I think the data hasn't yet caught up to it. Are there any early indications of any effects of that? And at what point would we kind of know for sure? 2 weeks out?
That's probably a good estimate because of the natural history of this disease. The incubation period can be as long as 14 days. What we know in the past, when we've seen, prior to the availability of the vaccine, when we saw our surges that would occur after summer holidays and things like that, it was about 2 weeks after either a holiday occurred or certain restrictions were lifted, that we were able to see which direction the curve would go. So I would say that if we are seeing significant impacts from relaxing of the mask mandates, especially relaxing of the use of masks by people who are unvaccinated, we'd have to look out for that 2-week incubation period for the disease to begin to assess the impact.
Chris, you've got a question?
Vaccine, the feds, that's been more of a trickle this last month. Has there been any communication that number could be climbing to maybe rates seen before the Baltimore related issues?
I'm not sure if I missed the first part of your question.
Yeah, I didn't hear it either, Dr. Bell. Chris, can you repeat that?
Apologies. When it comes to the Johnson & Johnson vaccine, has there been any update from the federal government that the rate at which it's being given to South Carolina will climb as compared to what we've been seeing the last few weeks because of the Baltimore plant issues?
I don't have additional information about that at this time. We have let our federal partners know that we're interested in getting an increased supply of the Janssen vaccine, but I don't have any updates about that now.
Heather, you've got a question?
Yes, thank you. Is there any update that you have on the incentives? I know in the last meeting, I believe there was talk about partnering with local businesses or, being at different places for that. Any update on the incentives?
Not specifically. We're continuing to, we're looking at best practices that have worked in other states that are potentially allowed here. We're encouraging certain businesses to offer perks. Some businesses are doing that independently. But from DHEC specifically, I don't have any updates about incentives for vaccination.
Chris, you've got another question?
Yeah. Thank you. So, Dr. Bell, given that the state is looking to get all the J&J doses that it can, and given that that number is limited, can you speak a little bit as to how DHEC is maybe deciding which rural communities to maybe push these doses toward to help the overall effort?
Well, we're working with individual providers who are serving communities, and they often have the best assessment of what the demand is in their community. So in certain populations, they may have visibility on what the desire is. And so in those areas, when local providers know that there is a demand for a vaccine that's available in only a single dose, those community services, churches, and things like that actually look to partner with vaccine providers who have that dose available. So it's really not a one-size-fits-all decision. It depends on the desire and the demand from those local communities and what those community leaders understand about their community's needs, their community's interests, and their community's acceptance and desire for certain vaccination products.
Are there any? Yes, Chris, you've got a follow-up.
Sorry, I'm just going to take advantage while I can. Okay, so the fact that this is demand-based, it sounds like. Does the fact that South Carolina is getting dramatically fewer doses than maybe it would have if Baltimore had not happened, is that making that process harder for rural communities, or maybe you and your team, or I guess what are the consequences of it, I suppose?
Well, as much as possible, we're hoping to offer choice in all communities. So we continue to encourage people to get the vaccine that is readily available to them as soon as possible. But certainly, we do know that there is increasing interest in receiving the Janssen vaccine. And we're doing all that we can to get as much of the supply as is available to us. So I'm not sure if that's answering your question, but that's the best information that I have about the supply from the distributor.
Mike, you've got a follow-up?
Community hesitancy survey. When should we expect that?
Mike, are you talking about the second community pulse survey?
Yes.
I can send you those results.
All right. Thank you.
You're welcome.
Christine.
Any other questions for Dr. Bell? Going once. Going twice. Dr. Bell, anything you'd like to, MK's got a question. Go ahead, MK.
This is sort of just a background understanding question, so I hope you don't mind me asking it. But I was just curious, Dr. Bell, if you could tell us, what, in hindsight, what treatments have worked best against COVID-19? And are there any that were popularized last year that we should kind of avoid mentioning now, I guess, just because they may have shown less efficacy?
Your question is about treatment for the disease, correct?
Yes, sorry.
Thank you. One of the most encouraging treatments that we've seen is the use of the monoclonal antibody treatment for people who have symptoms, who meet certain criteria, and who are not yet hospitalized. We've seen great success in the monoclonal antibody treatment preventing hospitalizations. We've also seen an improvement in the course of infections among those who have been hospitalized, who have been treated with remdesivir and other similar antiviral agents. As far as some treatments that were touted early on, we tell people to be cautious about recommendations for any treatments that have not gone through the Food and Drug Administration approval. that involves that they have been tested and shown to be effective as treatments for those with disease. So certainly in the scientific community, drug trials have to occur, and there can be, initial potential benefits. But until clinical studies are done to demonstrate that people are not recovering who would have recovered anyway without the treatment, that's done by using case and control studies to make sure that it's not just an effect by chance. So we have to inform the public that treatments that have not gone through protocols, clinical trials, and approval by the FDA are not something that we put any stock in if there's not scientific evidence behind the effectiveness of those treatments.
Chris, you've got a question?
Yeah, so going back to your topic on demand when it comes to, more clinics or maybe asking for this J&J, do you have any thought process as to why that is? Are more people just getting over their hesitancy when it comes to J&J, or what's the thought process there?
I think it's a combination of those things. I think people are getting over their hesitancy because we have good information about how rare serious adverse events are associated with that. So anecdotally, we know that many people find it very attractive to have the one and done vaccine, and you get immunity within 2 weeks after one dose, as opposed to immunity following the second dose. So that you're looking at being defined as fully vaccinated up to between 5 and 6 weeks after you started your vaccination series. So those are some of the factors that people find attractive and are reasons that they're looking for that specific product.
Are there any remaining questions for Dr. Bell? Okay. Dr. Bell, any last thoughts you want to share with the media?
I think it would just be to reiterate with my opening that we're really encouraged about the availability of the vaccine now for the 12 to 15-year-olds. We know that this will open up opportunities for that age group to participate in many activities that they have been held back from. It contributes to immunity in the population as a whole, because we know that there are still many people who cannot yet be vaccinated. And I'm also encouraged by our declining disease trends, but I just want to add the note of caution that we're still experiencing case report levels of up to 100, more than that per day. And that was really never our goal, that we still need to get far below that. We still have a lot of work to do. And so we are not to a point yet where we can completely relax these measures. It's so important for us to get so many more people vaccinated so we can all really more comfortably work, play, and enjoy activities in the community and normal lifestyle. So we just do want to encourage people to continue to keep that in mind and ask everyone to do everything they can to help us get there as a community. I just want to thank everyone for their attention this afternoon.
And in closing, I'd like to thank you, Dr. Bell, for joining us today. As a reminder to the media, we'll work to answer any unanswered questions via our Joint Information Center. And that concludes today's briefing. Dr. Kelly will join us next Wednesday. Thank you all and stay safe.
Thank you, Vivian.